this is Dr. Haas, and I am here with Ryan Jeffcoat, and we're going to talk about pulsed electromagnetic frequency, or PEMF. Everyone's asking me about this, and I'd love to just have a quick video to show everyone. This is the device that we're demoing here today in the office, the PER Junior, which delivers how many Teslas?
So that is, so it's going to be in the 16 Tesla range,
Okay.
16.2.
So the cool thing about this device is that it's super, super powerful. So you'll actually start by holding the two coils away from yourself and slowly bring them in, and you'll feel that energy. So it's a really neat device, and we're just going to talk about the basic technology. So can you kind of sum up exactly why PEMF is being used for so many things and how it kind of works?
Yeah, so the great thing about PEMF is it restores your cell's energy. And so it boosts that ATP process and allows cells to rejuvenate and also to not only increase their energy production, but also increase their detoxification. And so PEMF as a platform has incredible clinical data and success stories within healing and sports medicine, arthritis, whether it's pain management or recovery for athletes. This particular device, the Pulsed Energy Technologies platform, they have 3 of the strongest PEMF devices out there on the market. And because of that strength, it has been a big favorite of famous athletes like Shaquille O'Neal and pitcher Arrieta. We have a lot of athletes that utilize this for healing. We just had Aaron Judge just buy his second device of the Yankees. He's now off the DL and back producing for the Yankees, so it's fun to see those kind of success stories. But it is a very strong PEMF platform that you can feel immediately. So it's different than some of those more subtle devices out there where within just a few minutes on an injury or a joint, you can feel this PEMF just like a really deep tissue massage. And so it's a very, very obvious feeling, but it provides wonderful results.
Yeah, neat. So basically we're thinking about it as a generator that's sending out pulsed electromagnetic frequencies. And normally we're exposed to these all day long with basically our Earth is making a Schumann resonance pulse that we're typically exposed to. And then all of our electronics have different types of EMF. So people are always worried about EMF being a bad thing. So can you explain the difference between a bad EMF and a good EMF?
Well, as you know, everything needs to be subtle, and with technologies with EMF that's just constantly
a baseline signal
affecting our bodies with electronics and everything like that. That subtle, consistent frequency is going to have some great impact over time.
And these are typically very high frequencies that we're concerned with.
Mm-hmm.
As far
but
as
compared to like
EMFs.
a pulse, if you can kind of imagine the analogy of turning on a light bulb and that quick light and then turning it off, that is an energy and a pulse that our body can handle. And that's something that stimulates the cells but is not fatiguing them like a real constant resonating frequency. And so that is the difference.
Okay. And then that actually reminds me, I learned that our mitochondria actually turn on and off many, many times per second, which is pretty incredible. So we're not at a baseline of continually running. They actually shut completely down and then turn back on again, which is pretty fascinating. So it seems like our physiology likes to have, basically it likes to adapt. It likes to have different stimuli. It doesn't like to have the same thing all the time. We either will tune it out and our body will fail to recognize it, kind of like if we're taking some glutathione every single day, our body's not responding in the way as if we were to pulse it at, say, 5 days on, 2 days off. You're getting a much bigger epigenetic response to things that you pulse. So this is happening on a very fast wavelength. So is this like a 10-minute treatment? How do you recommend using it?
Yeah, typically when we have patients that start out, everyone reacts a little bit differently, with PEMF, and some have higher pain thresholds than others. Yeah, so for that first session,
it's intense. I wouldn't say painful, but it's intense. I can see why professional athletes would like it, because you can't really massage a professional athlete as deep as they need to be massaged. I mean, some people have figured it out, but they're exhausted. These massage therapists are like, I can work on like 2 football players in a day and I'll be completely wrecked. And
and I have a torn posterior labrum.
Yeah.
And the very first time that I used it, I could feel it inside, as deep in the middle of that injury as possible.
That's neat.
And that's a very common feeling.
Yeah.
What's nice about the Pulse, the particular platform that we'll be demoing today too, is that you can make it the most powerful treatment session, or you can even dilute it and divide up the wands.
Right.
So if you just want to go half strength on, on an injury for somebody that's a little bit more sensitive, you do have that option.
Yeah. Yeah, and I used it the other day, and I decided we need to bring this into the office and try it out on a lot of people, because I think it's going to have huge value for people, even if they can just use it once or twice a week. It's a great thing to have if you're a professional athlete or the Yankees coach or doctor or whatever, and you can get one and use it on the team every day, because it is a pricey investment. But as far as the benefits, how often do you think is ideal for people to use it if they were to come in and use it in an office setting?
There's so many different protocols, with PEMF, because it is going to be specific to if it is an acute injury, a chronic injury, is it something that they're trying to maybe heal a broken bone a little faster. There's clinical studies that you can find, basically in any need, and that is going to then make the regimen vary. We have some clinics for, let's say, a broken bone where they're coming in 3 to 5 days a week to treat that specific fracture. Then we have other patients that are going to come in just once a week for recovery. Maybe they'll come in for a 10-minute session before utilizing some of your other therapies, because it's going to help open up the portals and make a lot of those therapies more effective. We have clinics where some people swing by the location and get a PEMF session before they go to the gym. That it's going to really increase that energy. I think it's better than doing Red Bull.
It certainly gives you wings. No, when I tried it, that was the most impressive thing that I noticed. So I did the protocol. I think I was holding the two together. So you can open them up like a butterfly, as he was saying, to dilute it, or you can stack the two. There are these two circular pieces on top of each other. And I felt it right in my shoulder, right in my hip, when you're putting it around your low back. It's almost like it's shaking your bones. And I like that. So for me, I want a really deep tissue massage, or I do the prednisone injections, so it's really targeting the muscles and areas that are hurting in a deep way. But also, the other thing that I really liked was after finishing the session, I just felt really good. Just really clear-headed, really energetic, and I see how people would want to use that and then work out. Or we have a physical therapy center across the way, go do this, then do your physical therapy, do this, then get a massage, do this, then get some of these IV therapies that we do here, do this, then get some exosomes or stem cell treatments. So everything all works together to boost that mitochondrial function, the actual cellular energy currency, that ATP. You mentioned it goes up by 400 times after about a 10-minute session.
Yeah, there's studies that show up over 500% ATP production increase.
So that's going to make people that are tired and fatigued feel good. And another thing that I wanted to mention was I had seen just pages and pages of research studies on all the different effects that, all the different conditions that were benefited by PEMF. And the way that I think about it is that it just makes everything work better. So do the therapies that you're doing for these conditions, add PEMF, they're going to work twice as well, or, this is what I've heard. And that's pretty exciting to me, because things, we've got some really good tools in our toolbox, and if we can multiply the benefits by adding this in.
Yeah, anytime we increase that ATP production and restore the health of cells, it's going to be good for the improvement of all of our recovery processes, and it's also going to be helping boost the detoxification, which is needed. It's a two-way street.
That's great. Yeah. So helping heal injuries like broken bones, post-surgical. I've heard it's been great for traumatic brain injury, which is the brain's just not producing enough energy. That's part of the problem. So that's something a lot of people suffer with. What other conditions would you say kind of shine? And I know we're not, every PEMF device is created differently, and they have different protocols of what frequencies you're getting and what programs you're getting. So it's hard to extrapolate from the studies and say this machine is going to do all this. But what have you?
Yeah. So from the clinical evidence, and we really focus on the sports medicine and recovery aspects of it. You can find any clinical study out there that will reference PEMF for many different diseases. We focus on more of the arthritis, the pre-op, post-op recovery. Maybe even pre-op on preparing your body and restoring that before you're going to have a particular surgery.
Oh, that's brilliant.
And then post-op, of course, just the added boost in healing of bone and wounds. There's plenty of clinical evidence that shows different regimens being helpful there. So that's chronic pain, very specific immune deficiency disorders, and also from whether it be symptoms associated with Lyme, with fibromyalgia, rheumatoid arthritis, you name it. There's going to be studies in that area that shows a benefit. But what's nice too is, because this is a frequency that is communicating with your own frequency, everybody has a different reaction to it. Some people may come into your clinic and choose the 10-minute session. 5 minutes they may spend on one injury and 5 minutes on the other. They may spend all 10 minutes on one spot.
Or you can just put it on your liver, right?
Yeah. You can pick and choose how you do that, and everybody has a different reaction. So it's a nice customized approach.
Yeah. Well, I kind of just took it for 10 minutes and just moved it all over. I gave myself a kind of a whole body treatment in that amount of time, and you could even do a 15-minute treatment and probably get more benefits that way.
Yeah, definitely.
I like that you mentioned autoimmune disease as benefiting, and those chronic disease like Lyme disease, because there's a problem with energy production, there's a problem with detox, and there's a problem with inflammation. So we didn't mention that specifically, but it sounds like this would really bring inflammation down.
Yeah, and there's a lot of clinical evidence with different inflammatory markers being improved through PEMF.
Oh, that's great. That's excellent. All right. Any closing words you want to mention, or?
I just say, just come by the clinic and test it out.
Excellent.
And it's just worth trying out. It is. You can feel it immediately, compared to so many other subtle technologies that you're not really sure if it's working. You're not really sure if it's hitting that particular injury. You try it, just in the first 5 seconds, you will feel it, and you can adjust it right away.
Excellent. Yep. Seeing and feeling is believing. So we're going to have a successful demo day today, and hopefully we're going to have one of these in the clinic for everyone to come by and try. Thanks for watching.